Over the past several months, we have focused on the pandemic and vaccinations, but today we want to highlight another official need in our city. Blood donations are critically needed now and throughout the summer to ensure the availability of all blood types for patients that find themselves in need. As the city resumes some level of normalcy with progress in our battle against the pandemic, the hospital's demand for blood is increasing. And that is why I'm joining Chief Medical Officer Dr. David Persse and the Gulf Coast Regional Blood Center to urge eligible health individuals to make an appointment to donate blood today and throughout the summer. In fact, Councilmember Kubosh is providing blood right now as I speak. Doing so is essential to the availability of the blood supply, which ensures life-saving medical treatments are not delayed for patients in need. In the summer months and with school out and many businesses still working remotely, blood donations tend to dwindle. This creates a shortage in supply everywhere, including here in Houston. And that's one reason I decided to host a blood drive today at City Hall. In fact, one of my directors has been hosting blood drives for the last 7, 8 years, Janice Weaver, 8 years. And so this is just furthering what we have been doing here at the city and what people like Janice Weaver has been doing in her own right. With the largest medical center in the world, it's vital we have enough supply for everyone who needs a blood transfusion. You never know when you will be the person in need, so you should donate when you can. And finally, I want to say that as mayor, I have encouraged people to get vaccinated against COVID-19. So it is important to note that individuals who have received a COVID-19 vaccine can donate blood as well. Donating blood after receiving a COVID-19 vaccine does not reduce a donor's protection from the virus, and it does not hurt the recipient of the donation. In a moment, Cameron Palmer with Gulf Coast Regional Blood Center will tell you how quick and easy it is to donate. First, let me call up Dr. Persse, the Chief Medical Officer and EMS Director for the City of Houston, to explain why donations are so critical during the summer. Dr. Persse.
Good morning, and thank you again, Mayor. So, as the Mayor said, summer is upon us, and this is a time for family gatherings and for us to engage in summertime activities, and that's good. It's also a time, unfortunately, when things go wrong, when people get into accidents, and some degree with us coming out of this pandemic, we've had cases of people who are getting a little bit overzealous in some of their activities. We've had some serious car accidents, we've had shootings, we've had other things happen that people wind up in the hospital and they need blood, and they desperately need blood. There are situations when people can have catastrophic medical events, whether it be a car accident with a bad pelvic fracture, a gunshot wound that damages the liver, or the main vessel coming off the heart, the aorta. As we get older, a lot of folks have aortic problems, and when they start to bleed, those patients can sometimes require, and I'm not making this up, those patients can sometimes require as much as 100 units of blood to survive. 100 units of blood. So that blood has to be there for those folks. And these are survivable catastrophes if we have the blood available. In addition, on top of that, coming out of the pandemic, there are a lot of elective surgeries that were postponed. And elective is a relative term. For the patients who are getting the tumor resections that they should have had 6 months ago, these surgeries are very, very important, and they're going to need blood. For all the other types of surgeries that have been put off, and the problems are a little bit bigger now, and the need for blood, the need is now. We cannot wait for those folks. They cannot wait much longer, right? They've already waited as long as they possibly can. We need to get these surgeries accomplished, and the blood needs to be there so that they can be done safely. In addition, all of us love our families. Well, in order to have a family, there has to be a mom, and there has to be a baby. And sometimes during delivery, things can go wrong, and there's a need for blood during those situations too. So there are many, many, many situations for which we need blood, and sometimes it's large amounts of it. And so one of the things I want to point out is that, we do have a blood drive occurring right here, right now, just feet off the side of the stage here, that's co-sponsored by the Houston Health Department and the Gulf Coast Regional Blood Center. And I will tell you, I gave blood just yesterday, actually. And so, putting a little bit of the rubber meat in the road, and putting my money where my mouth is, whatever you want to say. So I gave blood yesterday. And every one of us is a source of good, healthy blood. And so let's go ahead and donate the blood And maybe, hopefully it won't be your family, but if it is your family member that needs it, then thank God the blood is there for them. Mayor.
Thank you. Thank you, Mr. Mayor. Thank you, Dr. Persse. My name is Cameron. I'm with Gulf Coast Regional Blood Center, and we are part of our community healthcare system. We supply 170 hospitals in a 26-county area with blood and blood products. Now, this year, we actually have seen a record number in donor turnouts, which is absolutely incredible, and we can't thank our community enough for coming out and supporting us. However, like Mayor Turner said and Dr. Persse said, we are in critical need of blood right now. As summer gets in, the pandemic, we're slowly recovering from the pandemic, and the roads are getting busier. We are seeing that influx in blood usage in our hospital. It's hurricane season, and everybody knows how unpredictable hurricane season is and how unpredictable that our Houston weather is, and we need to make sure that we are prepared in the event of a hurricane and we have to shut down for our collections. But we can't do this alone. We do need help from support from our city leaders and from our community, and we're asking our community to come out and donate blood today. Blood is a very easy process. Once you find one of the locations, it's just a quick eligibility questions, a quick health exam, and then you get put in the chair, you get sanitized and sterilized on the donation site, and just a quick stick, and you are saving lives in our community. Before you donate, please remember to drink plenty of water, get a good night's rest, eat before and the day of your donation, and please bring your ID. You will need your ID to donate blood. Also, if you have received the COVID-19 vaccine, you are eligible to donate blood. So you can donate if you've had the COVID-19 vaccine. And if you want more information, please visit our website at giveblood.org to find a location near you. And let's get out here and save some lives because our community really needs it. Thank you.
And then just to put a real face to what we're talking about, Janice, why don't you come up and just say how many pints of blood, I guess you would say, that you received, if you don't mind telling just to bring it home.
Yes, sir. So, first of all, thank you, Mayor, and thank you, Houston, first of all. So in 2013, I suffered a rare blood disease, and as a result of that, I needed a blood product, which was plasma freeze, and saved my life with over 500 units at that time. And so it's very important, and this is the reason that I do give the blood drives, because it is the way to pay it forward and to give back. And the thing about it is that you never know. And as Dr. Persse said, gunshot victim, car wreck victim, which is the condition that my body was in, and you just simply never know when you might need it. And so thank you, Mayor. And we're going on tour. It's what we call it, a blood drive tour, which is very important. So thank you so much. I appreciate it.
And Chief Pena, did you want to add to this? Chief Pena of the Fire Department.
Thank you, Mayor. I just want to echo the call for our community to get involved and get engaged and donate blood. Tragedies can happen at any minute. What's happening in Florida right now in Surfside, hopefully that doesn't visit any other community in our nation, but we never know. And the fact that we have a critical shortage of blood supply in our country is just something that we can do something about. So I encourage our communities to do a little bit of their part. 1 pint of blood can save 3 lives. So it doesn't take much of an investment of time to help your community to ensure that we have a life-saving product in case of an emergency. So thank you. Thank you, Mayor.